we are seeing a lot of people that are using this preventatively. So, a lot of billionaires like Grant Cardone or We Treat Kings of Country, even that come into us once a year, and they're healthy. They're relatively healthy guys, and they just get a systemic IV because they know what happens is these mesenchymal stem cells, they reduce inflammation systemically. So wherever they're going and they have a homing technique, they'll go to the place with most inflammation, but they'll help reduce inflammation throughout your whole body. They will also stimulate repair. So they start signaling your own body to stimulate the repair. And those are the two mechanisms that are going to help with longevity. So if you do it now, you might not have to go in for a kidney transplant in 20 years.
Right. Welcome to the Excellence Project. Eric Worre here. And today I have an entrepreneur, philanthropist, visionary leader. His name is Eric Stoffers. And he's created a company called BioXcellerator. And it's a company outside of the United States that provides high-level kind of custom service, stem cells, hyperbaric, high-dose IV therapy, exosomes, the works, and has treated everybody from kings to athletes to average people who are looking to improve their life. So we go pretty deep talking about the medical tourism space. We talk about where stem cell therapy is, what's coming in the future, what's working for sure right now, what's kind of unknown and untested, and what is nonsense in the marketplace. So I think you're going to get some good information. If you're interested in health, if you're interested in longevity, if you're interested in vitality and health span, not just lifespan, this will be an interesting conversation for you. So with no further ado, let's jump right into my conversation with Eric Stoffers. Eric Stoffers, how you doing?
I'm doing very well. Thank you very much. I'm glad to be here.
I'm glad you came to Vegas. We just before we turned the mics on, we realized we have some common friends in I guess the personal development space, longevity space, but you work largely in the stem cell world, and I'm going to have you correct me on all this, but really looking at the future of health, longevity, peak performance. And I'm super, super passionate and into health, longevity, and peak performance. So talk to me about, let's just start by, what is the state of the union when it comes to longevity, health, and peak performance, and our ability to impact all three?
Well, the state of the union is that it's still broken, but the good news is that we're heading in the right direction. And what I mean by that is our healthcare system in general in the United States is, I'm sure you've heard the term, it's sick care, not healthcare. It is very, very little in the way of focus on preventative and personalized. But again, the good news is that even after COVID, we've seen a shift. We've seen a real shift in the mindset of at least Americans in their desire to be more preventative and then getting into health optimization and longevity and peak performance. So this is people that are now taking their health into their own hands. And that's the key. You have to take your health into your own hands. You can't rely on your local doctors to tell you exactly what you need, because unfortunately, the medical system is not set up to even have your doctor-patient relationship be the way it used to be, in the sense that now you have pharmaceutical companies, and even worse, you have big insurance that are in the middle of your healthcare, and they only care about profits, not health.
Yeah, so they're dealing with symptoms. There's only 2 countries in the world that allow
advertising.
I know
where you're going.
of pharmaceutical prescription drugs, New Zealand and United States.
Yep.
They're the only 2. And I don't think they're complaining about having to put all those disclaimers on there. I work with people in the marketing world that are always complaining about the fact that they have to put disclaimers on stuff. I said, guess what? Big Pharma's not complaining. They just figure out a way. Tell me what I got to say, because the desire for the result that people are looking for is bigger, and they just basically tune out all the objections. Like you could die, your head could fall off,
20 seconds of the 30-second commercial or the 1 minute commercial is all you're dying, you're going to die, you're going to vomit, you're going to,
yeah,
you're gonna
all the
lose
bad things
your
that
first
could
child.
happen.
Yeah.
But you might be able to help with this symptom over here. And that's enough. See your doctor, results may vary, all these different things. So I keep telling marketers that consumers really don't care about disclaimers so long as they feel like there's a reasonable amount of hope.
But on the flip side, and I think this is getting into borderline criminal. I don't want to get too conspiratorial here, but
Go.
great companies like mine, where we are trying to be very preventative and personalized, and really just our mission is to help people. We want to help alleviate suffering, and we want to help change the quality of people's lives. And my company is not allowed to advertise. I cannot traditionally advertise like any business, really. I can't buy a Google AdWord or Facebook. I can't SEO optimize.
Is that just in the United States?
That's just in the United States.
You can't advertise health, longevity, and peak performance.
I could use those terms, but once I start talking about what really is the differentiator, stem cell therapy, advanced cell therapies, exosomes, then it's absolutely no.
So why can pharmaceutical companies advertise
Because those drugs are FDA approved.
Xanax?
FDA approved. They've gone through, hundreds of millions of dollars of research and development, which is also kind of a farce at this point. They really just repackage most of their drugs. They did all the research and development, 40, 50 years ago. And then now they just keep putting little different molecules and repurposing a drug. But, their big argument is that we spend all this money on R&D. That's why we should charge so much, but they're FDA approved.
And because of that, then they're allowed to advertise, so long as they disclaim properly.
Mm-hmm.
And they still open themselves up to lawsuits, which I'm sure they get all the time. Cost of doing business.
For sure. Except they also have baked in some pretty good protections, especially in and around vaccines. They will never be sued for any wrongdoing or bad manufacturing or malfeasance.
Wow. So let's talk about the positive.
Okay, good.
Well, I want to talk about all of it, but up until about 2 years ago, I've started and stopped on my health journey hundreds of times. They say it takes 21 days to build a habit. That is bullshit, in my opinion, because I've done more 21 days of perfect and then one weekend and I've lost it for 4 to 6 months. You know what I mean? Then I'm like, oh, this is ridiculous. I got to go again. So I'll go again. So in the last 2 years got serious. Working with Gary, Gary Brecka, who's a mutual friend and a client of yours.
Correct.
Working with Gary, working with trainers, working on nutrition. Nutrition's still the big final boss. That's the toughest boss. I got the calories, but the macros aren't exactly where I want them. But what was so funny is, for a person of my age, is when you're sedentary for a long time, working entrepreneurially, and then all of a sudden you go in, the risk of injury is high. So I had 2 big injuries over the course of the last 2 years. One, I blew a quad muscle out, which took quite a while to recover, and had to reconstruct a shoulder completely, bicep tendon, the whole rotator cuff, the whole thing. And that recovery is no fun. But I'll tell you, in the last 6 to 8 months, I can go now. The connective tissue's back connected between all my different limbs.
And was it just surgery, or did you do any regenerative medicine?
I did some exosomes.
Okay.
I did some injections of localized injections of stem cells for my shoulder, but it was too torn up. It was just.
And you did that here in the States?
Yeah, it was ripped to shreds.
Yeah.
So,
in my opinion, those are it's typically low level science. So that it's tough to heal
Yeah.
high
So, I
level
mean,
injuries.
my ortho, who's a very good friend, it's too torn up.
Yeah.
It would, there's all kinds of bone spurs in there, and there's all kinds of issues in there. And the rotator cuff was just demolished, and the bicep tendon needed to be moved. And,
But you're on the mend. You're feeling good now.
I feel good.
Perfect.
I can go as hard as I want to go without feeling like I'm going to injure myself. Where at the beginning it's like, oh, better be careful. You're going to hurt yourself.
Yeah. How much weight did you lose?
Maybe 20 pounds,
Okay.
but I've gained probably 20 pounds of lean muscle
Great.
at the same time
Amazing.
in the last 2 years.
Yeah, great.
So lost 20 of that and gained 20 of the other. So still can drop some pounds.
Well, congrats, because it's. I mean, I know I'm down 45 from where I was on my entrepreneurial journey at the beginning and being sedentary. So I have a similar story, but it's very hard work that gets you there. The exosomes and the stem cells, all that is great, but you've got to be dedicated and put in.
I got
hard work.
everything, man. I'll take you around the corner into the gym. I've got the oxygen tank next to my treadmill. I've got a red light therapy bed, the full highest, biggest you can get. I
Nice.
got the infrared sauna.
Yeah.
I've got the cold plunge. I'm getting a hyperbaric chamber.
Super important.
I've got.
That's magic right there. Actually.
Is it?
Yeah. Hyperbaric's amazing.
Yeah. So I was just talking with another doc this morning about getting that done. There's a guy who kind of custom does them for a lower price than
Nice. Yeah, they're expensive. Just make sure most of the studies show that you have to be at 1.5 ATA.
Yeah.
And the soft shells are usually only 1.5.
These are not soft shells.
Perfect.
This is hard shell, welded, the whole full
Perfect.
tank you're going into, which from what he says, the hyperbaric is a game changer. So doing all the stuff, work out with a trainer, average probably 5 days a week. I got to up the cardio a bit. So the muscle stuff is better than the endurance is. So I got to get the cardio vascular endurance higher, get my HRV up.
Mm-hmm.
My HRV is low compared to where I want it to be. I have a friend of mine who's 70 and he sent me his HRV was 84. And I'm like, I hate you.
That's nice, especially for an older guy. Yeah.
Oh my gosh. And he's in super shape. I mean,
Yeah.
he's a cyclist and, 3 hours a day during the week, he's working out hard. 5 hours a day on the weekends, he's working out hard.
That's the real key to longevity. I mean, all these other ancillary treatments are
Really?
also important components. Hyperbaric, there's some really neat studies out of Israel right now relating to lengthening of telomeres and longevity. But my point is that it's really the exercise routine and muscle.
Adding lean muscle.
Lean muscle.
Yeah. So I've gone from 140 pounds to 160 pounds of lean muscle. And I feel like that's a good number. And then from there, just want to lower the body fat, taking the body fat from 34% to like 21.
Okay. Heading in the right direction. Good.
So
But you're feeling good.
I'm feeling much better.
Yeah.
I want to get to 15. 15 is my goal. Everybody says that's really, really a challenging goal for a person of my age. We'll see.
Yeah.
But I'm going to lean on it until we get there. I saw an interview with Ray Kurzweil, which I'm sure you're familiar with Ray, the futurist. And he talked to Joe Rogan recently about longevity escape velocity. Have you heard this
No,
term?
I haven't. I didn't see that episode, and I haven't. I'm not familiar. No.
He's predicted accurately advancements in technology for the last 60 years.
Mm-hmm.
And he says we are 5 years away from longevity escape velocity. And here's how he describes it. He says, it used to be a year would go by and your body would age a year. Today, your body, a year goes by and your body ages about 8 months because of advances in technology. Things like you do.
Mm-hmm.
He said by 2029, a year will go by and your body will not age. So we will achieve stasis, and then it'll start to go backwards. the lengthening of the telomeres and everything else that you were talking about. It'll start to go backwards. We're not going back to babies or anything, but he says longevity. The other anti-aging doc, I've had like 3 anti-aging docs, says that if I can show up in about 10 years without any major systemic issues, then living to 120 is a lock. So I'm like, all right, that's my goal. 120, I'm going to just lay that out there and see what happens. He said, and your kids, so long as they don't abuse themselves, on average, can be higher. So my question to you is this: do you believe that? First, do you believe about the human body's ability to live longer and better?
Yeah, I mean, I don't know if I go as far as I look at it through a different lens. Let me start there, because and like we've talked about Gary Brecka being one of our patients, and we have relationships with a lot of the other longevity and thought leaders in the space. I really enjoy listening to Peter Attia and Dave Asprey and all of them. Brian Johnson, if you're familiar with him, he's taking it to the next level. And I believe that guys like that are going to live to 120. I mean, the truth is we're doing something similar now in blue zones. But for me, I look at it as health span more than lifespan.
Right.
And so, I don't care if I'm 120, but I feel horrible in the last 8 years or 10 years, and I'm not able to have the same level of activity. So I believe that that's going to come first, where we're seeing people that are really just passing away, maybe in their sleep, but they've had an active life up until the day they die. That's what I think we're going to see first. And then it'll continue to get into the 120s where people are still feeling good.
Yeah. The doctors that have talked to me said it isn't a gradual decline that most people think it is. It's just you're kind of going along and then boom, it falls off the cliff.
Mm-hmm.
From whatever, either there's some event that happens, or you die in your sleep, or you slip and fall at age 85 and the dominoes start to fall, or there's some systemic thing, cancer shows up later on in life, and boom, you have a bad year and you're out.
Yeah,
but it's not really this slow 5% decrease a year for 20 years.
Yeah.
That ends up doing it. Is that what you're saying?
Yeah, I would say that that's accurate now in the way that we're seeing the mortality rate. But, I think my point was more in the sense that you want to make sure that you're pushing towards all these alternative therapies to really feel great in your advanced years. And you can't help the random acute event that happens. I mean, it's the fall and break your hip. Yeah, you can't really help that. But the truth is, you kind of can. If you're working on the muscles, the things that make people fall are usually because they're a lack of muscle, grip strength, they're sitting on the couch all day.
Mass, they can't catch themselves.
Yeah.
Is this a rich man's game? Is this a rich person's game? At least now.
Now, unfortunately, it somewhat is, and what I like to do is reframe people's mindset in that case, because look, we're very blessed to have a lot of celebrities and professional athletes that not only come to our company and are vocal about talking about us, but it's not just the professional athletes and celebrities that can afford this. It's not inexpensive. It's around $25,000. So that's not inexpensive, but
for stem cell therapy.
Yeah. And that's for a full body systemic treatment. And
everything.
So that's for everything. That's for a guy that's coming in and that has, 2 joint issues or 2 knees, 2 shoulders, wants a systemic IV, and he wants his companion to have an aesthetic treatment also. So $25,000, $30,000 is typically what we see people come in.
Hold on, before I didn't understand half of what you said.
Okay.
So 25 grand, you get stem cells.
Oh yeah.
What else do you get?
Well, for our clinic, we have a full treatment week with ancillary and supportive therapies that go along with stem cell. So we have you in the hyperbaric chamber several times during the week. We start you off with bioregulatory and orthomolecular IVs. So it's basically like vitamin IVs that are specifically designed to help your specific condition. And this is something that we do differently than most other companies in the sense that we're very personalized. We're very preventative and again, personalized. So we're going to start you off with these high dose IVs that are going to help decrease inflammation. They're going to help ready your body for accepting large doses of IV stem cell.
Okay. And I apologize.
It's okay. It's all right.
I didn't say it up front. The name of your company is?
BioXcellerator. We're an Arizona-based company, but our main treatment facility is in Medellin, Colombia. Most people know it as Medellin. Locals call it Medellin.
Right.
Which, by the way, is a beautiful vacation destination. People are using it as my clinic as this wellness vacation.
I've heard single guys go down there and never come back.
There's that too. There's lots of beautiful women there for sure.
Yeah, I've heard.
But it's a beautiful country. The people are nice and it's safe. Now
so BioXcellerator, stem cells, hyperbaric, IV, high dose IV therapy. I'm assuming exosome treatment as well.
Yep, we have our own exosome therapy that we add to our stem cell. So that's a complement. It's not a and/or. They're together. Typically for orthopedic issues.
Because the exosome therapy that I've done here is not cheap.
No, it's very expensive. But stem cell is more expensive actually.
Right.
Yeah.
But I mean, well, when you're talking 20 to 25 grand, including exosomes.
Yeah. It's a fantastic value. Yeah.
Right. So basically these four things: stem cells, hyperbaric, IV, high dose IV therapy, and exosome.
No, there's more. No. So we'll take people through ozone therapy during their treatment week with us. We'll also take them through cryotherapy.
Ozone being you pull the blood, oxygenate it, put it back in?
Yep, exactly.
Okay.
Ozone therapy, cryotherapy, red light therapy. Before they come to our facility, we have them on a nutrition program at least 30 days prior to. So it's mostly just an anti-inflammatory diet, but we have a personalized nutritionist that works with you individually. So, for our professional athletes, they can't go on extremely low anti-inflammatory diet because there's animal proteins that are involved. So we tailor the nutrition to them. And then we also have nutraceutical program that helps prep your body as well. So it's a full package.
What's nutraceutical?
We typically, start doing a liver detox. We use high dose magnesium to oxygenate the gut. We also do epigenetic tests. So we take your specific epigenetics and what your body is and the environment of your body, what you are deficient in or how you will be able to accept some of these vitamins.
Got it. So that's a lot of stuff.
Yeah, buddy.
How long does this take?
Well, we like our patients to be there for 5 days.
5 days.
So Monday to Friday. Now, you don't have to be. We do have shorter protocols. A lot of times we treat professional athletes that have been to us already and they just need to come in to get one joint injection and leave. So you could be with us for as short as a day. But for our first-time patients, and especially as we're developing the personalized program for you, we want you there for that first week.
So let me ask you a personal question. My mid-back is achy. Just aches.
Mm-hmm.
So if I stand for too long or if I'm speaking for too long, it's the only part of my body that is just like, I can't ever really quite get it comfortable. And I don't know what the issue is with it. Is there something with stem cells that can help with that?
We wouldn't know until we examine, if we get images and maybe some of your medical records, our physicians will be the final determinant.
Chiropractic thing?
No, I would say first actually is PT. I would look into you could.
Because I'm training. I'm training hard.
Yeah, but physical therapy, their good ones are going to look at what you do, even from an occupational standpoint. The way that you're sitting in your chair now, or even the way that you stand up. If you're not engaging your core and using your glutes, and you're just using, let's say your hip flexors.
Yeah.
Well, that might be putting too much strain on your lower back. And over time, that's just going to give you some aches.
It's mid. It's so weird. It's not lower.
But
I'm super tight, which I'm working on.
Mm-hmm.
If I had to touch my toes to save my family, they're all going to die.
Oh,
with my legs straight. I'm so tight, and my hip flexors are super, super tight. So my lower back used to be an issue, but I've strengthened that, and it's not a problem. It's just mid. It's just under the shoulders, above the lower back. It's just kind of awkwardly uncomfortable.
One of the things that I did is when I was opening the clinic, I went to at the time, it was the only and certainly arguably the best clinic in the world that does what we do, high-level mesenchymal stem cells. It was Dr. Reardon in Panama. So I went to his clinic and we sat down and we had dinner and we were talking about what he wished he could do or what he wished his clinic could do better and some of their deficiencies. And that was having more invasive treatments is specifically related to spine and disc and back issues. So that's something that my clinic does do. We have 2 neurosurgeons that work with us. We do soft tissue injections. We also go more invasive where we actually inject into the spine and disc. Wow. So the discs and facets. So if anybody in the world could help you, it would be us. I can't tell you just by conversation though.
All right. Fair enough. So tell me your story. I mean, you're a young man. How did you get into this game?
Thanks for the young part. I appreciate it. I'm a business guy, so I had no medical experience. I had no scientific aptitude at all. I spent the early part of my career, including my very first job ever in the restaurant business. And through university and through, the early part of my 20s, I worked in the restaurant business. And so I was in every aspect all the way up to the top. And when I got out of that business, I went into the real estate business. And as I kind of reflect on how I got into the stem cell business, I think it started way before that in the sense that—
When was this?
I founded the company in 2015.
Okay.
Yeah. So for me, the mindset, I believe, started when I was very young, in the sense that I had a lot of people in and around my family, and my grandma was a nurse. And so I watched her give her whole life to caregiving and to being in the healthcare industry. She was a sweet little Midwestern lady that never drank, never smoked, never used a cuss word. But I watched her get addicted to allergy medication. And so—
Allergy medication.
Mm-hmm. Yeah. And it was, if you look back on it, it was wall-fed is what she was addicted to, because you could get it at Walmart, but it was an ephedrine. And it was just it was a stimulant upper. And I watched it change her personality. And so it really turned me off on pharmaceuticals as a young kid. I got in fights with her about taking pills.
So that's like Claritin. And,
yeah. I think it was,
all of that
I think there was other ingredients that were probably, a little bit more addictive at that point.
Wow.
Yeah.
So how did that affect her negatively?
I watched her personality change, right after taking these pills, but she also became kind of aggressive in the way that she would push these on the other family members. And that's kind of, I digress, and I'm just kind of—
okay. It's good to know the story.
Yeah. So, I think that the mindset started back then, and I was very much against traditional pharmaceuticals. And because I watched what it did to her and others in my family. I also, while I was in the restaurant business, I had 2 people that were close to me. They were employees, but friendly, die from addiction to opiates. And, I watched what it did to their family.
How big is that getting nowadays?
It's horrible. Yeah.
Just crazy.
It's crazy. And it's crazy that some of these private industry pharmaceutical type companies can buy their way out of that. Yeah. So
seems like they have
100% they have. Yeah. The Sackler family and some of what was going on with OxyContin, and it's incredible. And when I watched, the FDA allow those type of drugs to have things on the bottle that say that they're safe and they're non-addictive, it makes me want to pull my hair out, thinking that I can't even advertise on what is really safe and non-addictive. And that's natural treatments like what we're giving.
Crazy.
Yeah.
So 2015, you make a decision, but how do you make a decision? You got this life history, seeing all this stuff that's going on. You say, I'm going to get into the longevity space.
It wasn't a quick—
Were you into longevity, health yourself personally?
No. This is when I was kind of a fat guy. I was sitting behind the desk of a real estate office. I was the CEO of a real estate company. Very happy in my job, but my girlfriend at the time, long-term relationship, was in the medical device sales industry. So now I'm watching these friends of mine who are orthopedic surgeons and my girlfriend at the time that is in the medical device sales space, and coming home, and every night at dinner, she would sit down with my daughter and I and her and talk about the scandals that were going on within her industry. And a lot of times it was, it was how they were getting these products approved. It was using these loopholes within the FDA to not go through clinical trials through these new devices. And so I'm
or
listening.
call 12 people a clinical trial or something.
It's even worse. They have the 510K rule where they can essentially take an old product that was developed 40 years ago and put a new package on it, or call it a new name, or not change it materially, or even change it materially, and they can just get it approved immediately with zero research. So I was watching this happen, and at the same time, as I was selling this large piece of property in Cabo San Lucas, actually, we were really getting beat up on the offers that we were getting. So it was this big rundown resort, beautiful, like 300 hectares on beachfront. But the Starwoods of the world were coming in and giving us really terrible offers. So as a function of thinking outside of the box, just from a marketing perspective, I said, hey, why don't we sell this to medical tourism providers? We're here in Arizona, and we're hearing, people are using this term medical tourism. And my dad went across the border to get dental work done. And, I knew some people that went and had, aesthetic work done. And so I said, why don't we market to medical tourism providers? And that's where I came across a group of stem cell scientists that wanted to take their technology out of their laboratory and put it into practice, but they couldn't do it in the US. So they were looking for a facility in Mexico. And that was my first introduction to real stem cell. Yeah.
So it's like, okay, I'm gonna, and was there a lot more demand there?
There was demand there. You know what I found, and the reason I know
this partner somehow.
No, we actually didn't open there because we couldn't find what we were looking for, in the sense that we were looking for not just longevity treatments, which are pretty easy. They're usually healthy people that are just getting an IV or maybe some joint injections. We were looking to treat even more devastating diseases and spinal cord injury. And there is not a good infrastructure for that in Cabo. It's a vacation destination. There's some, kind of lower level docs. There's not a lot of neurosurgeons there. There's not a medical university. There's not a big hospital system.
So medical tourism is turning into a thing. And like, if you're going to go get hair transplants, you go to Turkey.
For sure. Wherever. Yeah.
That's like the hair transplant capital of the world.
I have some friends that have been there. It's amazing.
Yeah, I guess. I mean, and there's many places in the world where just, my mom and dad live in Arizona, mm-hmm. and they drive across the border to Mexico, and there's this little medical town that just does all dental stuff.
This is what I was saying. My dad did the same thing.
Did he?
Yeah.
Because like a crown instead of $3,000 or whatever is $200.
Exactly.
Same trained people.
Mm-hmm.
So it's worth it to get on these airplanes and go someplace in order to be able to get even simple stuff done sometimes.
Yeah, absolutely. I mean, now I'm biased because I spend a lot of my time in Colombia, and I've gotten to see over the years how great their medical system is. And a lot of it comes down to care, but it also comes down to the training of the docs. They're very well trained, very well respected around the world. But now I get all my care there. And what I'm seeing a lot of people do that aren't, living there like I am, is they're flying, it's only 3 hours from Miami, but they're flying there instead of getting, even if it's a normal thing like breast augmentation, instead of spending $16,000 in Scottsdale, go have a nice vacation, bring your kids, bring your family, get your work done. And it's going to be still half the price, and you had a vacation.
And where's the best place to do the breast augmentation stuff?
There's a big market for that in Medellin.
Yeah.
Yeah.
And
Brazil's really pretty good too.
Brazil also?
Mm-hmm.
Okay. So interesting. All right. So you make this decision. You're going to sell your property, but it kind of doesn't work out?
No. The property did not work out at all. In the sense that we were too far from a hospital.
Yep.
It was far from the airport also. So from a medical tourism's perspective, it was going to be a bad patient experience. This particular property needed too much work also. So then it was just becoming a money pit when we started adding the dollars and cents.
Yep.
So we bailed on that from a medical tourism perspective. Now the people that I was co-marketing it with ended up selling the property.
Yep.
But to this particular group, we did not partner with. But what happened is, over a couple of years, these guys kept kind of pinging me on the side and saying, hey, we really enjoyed working with you. We're really looking for a business person to help us. We're doctors, we're scientists, we're not business people.
We need the tourists.
And that too, of course. Yeah. But
we need somebody to bring us the medical tourism to Mexico in this case.
We've got the science, but we don't have the other aspects of business.
They don't have the marketing piece.
They didn't have the marketing piece. They didn't have the longer I dealt with them, they didn't have the business acumen at all. So
they just knew how to do the procedure.
That's it. Yep.
But were they world-class at the procedure?
As it turns out, this particular group, no, I bailed on them. Once I dug deeper and really started.
You got to be careful, don't you?
Oh, for sure. There's a lot of charlatans out there. Yeah. Unfortunately, the stem cell space has a bad name for a good reason, because there's a lot of people out there that are way over promising what stem cells can do. And partially that's because they're safe. They don't really have a major downside, but people are out there over promising.
Right. Okay. So next step, you're now your interest is peaked.
Now
a couple years go by. These guys don't work out. Then what happens? Yeah.
Now I'm enamored. Now I'm going in saying, hey, this is really going to change a lot of lives. I think it's going to be a good pivot for me and what I could do for my community. It's a good business opportunity. And so what I do is I start looking around the Western Hemisphere. So obviously we started in Mexico, like I just said. What happened, because Mexico was my first destination, what happened is I went to the COFEPRIS, which is the equivalent of the FDA. So the COFEPRIS is their regulator in Mexico. And the first couple of meetings, I presented our case. I presented what we wanted to do, what we were planning and intending to do, and that we were looking for a good city with favorable regulations and medical infrastructure. And the people at the COFEPRIS, and these were very low-level people. I didn't have a reputation. I'm not a doctor. We didn't have a brand. We hadn't treated anybody yet. So I was starting at the bottom. But these people at the bottom never asked me, Eric, they never said, how much money are you investing into our country? How many Mexican jobs are you going to create? How many people are you going to help? What technology are you bringing? It was always like, how much is it me personally? Yeah. To get to the next meeting. And so that really turned me off. And so I stopped looking in Mexico at that time, and I started looking in South America. And when I was looking in South America, Colombia was the very last on my list. And I was like most Americans, where I knew about Colombia because of Netflix and Narcos and Pablo. Trade, yeah, Pablo Escobar. And so I was looking into Chile and Argentina and even Brazil. And I kept looking for these three very important things. I was looking for really great and very robust medical infrastructure. Mm-hmm. I was looking for very well-trained and well-respected doctors. And then I was looking for the good regulation for stem cell therapy and advanced cell therapies. And every time I looked for those three things together, not just one of them or not two of them, but all three things together, Colombia just kept rising to the top. So then I kind of reluctantly said, okay, I'm going to check out Colombia. I went to Cartagena, I went to Bogota, and then when I found Medellin, that was it. It was a wrap.
How did you find the people?
To work?
Yeah.
My initial couple hires were headhunters.
Hmm.
Yeah. Yeah, I really didn't have any contacts.
This is 2015,
mm-hmm.
So 9 years ago.
Mm-hmm.
So you start with in Medellin and say, okay, we're going to put together a clinic. Is that the plan?
Yeah. Yeah, but it was more specific than just clinic, because what you're seeing a lot of practitioners do, especially here in the United States, is it's a doctor that has a clinic and they're just injecting you a stem cell, but they buy those stem cells from another laboratory. Well, herein lies one of the major problems, is that that laboratory has no relationship with the patient. And so what I wanted to make sure to do was having both the laboratory and the clinic together. So we're actually three individual companies within a company. We're a innovation center, research center, and laboratory, also the treatment facility, and then the alternative therapies. But it was very important to find the high-level scientists that had at least a decade of experience in culturing and culture expanding stem cells, that were also willing and able and intelligent enough to put together specific protocols with global evidence to actually do the treatments within the facility.
So how did you get like your first clients down there?
At the beginning, I did what we affectionately called seminars. So I just was in my local area in Scottsdale, Arizona. I was doing dinners with physicians and potential patients and talking to them about the benefit of stem cell therapy and why we're in Medellin and why they have to go all the way to Colombia versus what they might be advertised, for those guys spinning the signs on the street in Scottsdale, and what the difference was between what they're able to get in the United States versus going offshore. So that's how we got our first clients. After our first UFC fighter came, that was the game changer, I would say.
You have a relationship with Dana and UFC and those guys, or no?
Not Dana personally. Everybody in his organization. I mean, his higher ups. I'm
surprised he hasn't, just because he's a big Gary Brecka fan.
Yeah. I think I know Gary's talked to him about us many times. He's a busy guy, but I think he has a financial relationship with another clinic at this point. Yeah.
Got it. Okay. So innovation, treatment, and alternative therapies you're doing in Medellin. And so like year one, did you put in all the money yourself?
I put in a big majority of it, but I also raised capital. So, from a business,
you got some partners.
Yep. We had partners. At the very end, I was tight. We had enough to start, but I wanted a cushion. So the last couple of investors, it was cold calls. And if you can imagine
or free treatments, right?
No.
Did you do any free treatments in exchange for equity?
No, I didn't do that. No, I didn't do that. But if
that would have worked,
I wish I would have thought of that. I didn't do that. But
if they're going to spend the money anyway,
yeah,
they can have a piece of the action come down.
That's a good point.
Well, anyway,
if you can imagine those first couple phone calls over, I was like,
"Hey, I can imagine.
I'm Eric Stoffers. You don't know me, and I don't have a medical background or scientific aptitude, and I'm going to put together the highly advanced and very controversial stem cell clinic in Medellin, Colombia, and it's not covered by insurance, and it's very expensive. Who wants to invest with me?"
Right. How many employees do you have now?
We're about 103, 105, something like that.
All in this one location?
No, we also have our administration is in Scottsdale, Arizona. So our corporate office is there. So all of the C-suite and marketers and, admin people, also our patient advocates. So these are people that are taking phone calls every day, walking you through the process. We kind of take a white glove approach. So you have somebody that is taking you through your whole journey.
So regulators don't mind that you're promoting it, just so long as the procedure happens offshore.
No, I still can't promote it. The FTC sent me
support it onshore.
Yeah, I mean, in the sense that I'm allowed to have a business.
Yeah.
I'm allowed to have a business that is, solely focused on getting, these people to Colombia. Yeah.
And that's okay.
Mm-hmm.
And how many of those in Arizona versus what you have in Medellin?
We're 80-20.
Okay. Which way?
Colombia. Colombia is heavy. Okay. Yeah, because all of our support staff are there. We have an innovation center, which is a group of epidemiologists that are just continuously writing clinical trials and case studies and reporting on our patient outcomes. And then, of course, all of our physicians. So I have 20 plus doctors, all MDs, neurosurgeons, orthopedic surgeons, emergency physicians, and then the nurses and all the other support staff.
I just want to jump in and say, I hope you're getting value from everything that we do at the Excellence Project. And if you do, make sure to follow us on all the social platforms. If you look up Eric Worre or the Excellence Project, you can find us on Facebook, Instagram, TikTok, YouTube, LinkedIn, everywhere where you get your content on social media. Find us over there. We'll continue the conversation. Back to the podcast. So this may be boring to our audience, and I kind of don't care, because this is interesting to me, because I think longevity in the direct sales network marketing space is important. And like some of the stuff that Gary does that I think is smart is he says you can get a PEMF pad on your bed, or you can just go ground yourself in the morning, get out and put your feet on the actual earth.
Yeah.
You could, have
$120,000 red bed,
red
or you could
light
go get
therapy
some
bed,
sunlight.
or get some early morning sun.
Yeah.
Or
I love that he gives those alternatives.
Yeah. Or breathing exercises instead of an oxygen machine, stuff like that. There's not really anything like that here though. There's like, it's either you do it or you don't.
Yeah. I mean,
and I'm guessing 5 years down the road, just because of quantities and stuff, costs are probably going to come down and in competition.
That's my hope. That was my hope going into this. I really wanted to bring this to the masses. I wanted to, when I was looking at the space, and there wasn't many players, but it was very expensive.
But if it comes in the United States, isn't Big Pharma just going to ruin it?
Yeah, it's not going to prices aren't going to come down. If it comes here, prices are not going to come down. They're going to go up. And it's going to get watered down, in the sense that there is a logistical issue in the way that you have to cryopreserve these cells, and you really lose almost all viability if you start shipping them across the city or across the state or across the country. They lose viability within the hour. Wow. And so this is why it was very important to have the laboratory attached to the facility. When you don't see that, you're probably not getting what you're paying for.
Here's my view on health. As far as if you care about how long you're going to live and how well you're going to live, well, health span versus lifespan, right? You're either going to pay the doctor or you're going to pay somebody else. So pay somebody like yourself, or you're going to pay a hospital to treat some symptom. Right? Yeah,
we are seeing a lot of people that are using this preventatively. So, a lot of billionaires like Grant Cardone, or we treat kings of country even, that come into us once a year, and they're healthy. They're relatively healthy guys, and they just get a systemic IV because they know what happens is these mesenchymal stem cells, they reduce inflammation systemically. So wherever they're going and they have a homing technique, they'll go to the place with most inflammation, but they'll help reduce inflammation throughout your whole body. They will also stimulate repair. So they start signaling your own body to stimulate the repair. And those are the two mechanisms that are going to help with longevity. So if you do it now, you might not have to go in for a kidney transplant in 20 years.
Right. So I've got on hormone therapy. Mm-hmm. So do you guys do that too, or just leave that here?
We leave that here. We do prescribe it. Once we look at somebody's medical records, that'll be a pre-treatment protocol for us, but we don't do it.
Right. One of my biggest issues that is a risk factor for me to be vulnerable is visceral fat. I've got too much visceral fat. Started with crazy amount 2 years ago, 5.5 pounds of visceral fat. Trying to get under a pound. I'm at like 2.9 now or something.
Great. Big progress.
Is there anything in the treatments that you do that would assist with any fat burning or visceral fat issues, or
other than the alternative
just
therapies?
General inflammation? Is that going to assist with that at all, or no?
I don't think so. No, I think it's the path that you're on is probably the only thing that's going to help that.
Okay. What is your opinion on the GLP-1 fad?
There's not any longevity studies necessarily. I mean, we don't know what it's.
So we just don't know yet.
Yeah, we just
Mounjaros and the Ozempics. And
people
are losing weight, which is good.
That's what I was going to say. We're seeing people lose weight, and that if that's the catalyst to get them in the right mindset to do some of the other things that are necessary, I'm all for it. But if they're just planning on the pharmacological model where you do an injection and you're going to lose weight, that I don't foresee that being a long-term solution.
They got to move their body.
Yeah, you got to move.
You got to watch what mass.
Yeah, you got to watch what you're putting in your mouth. And here in the United States, we can't even help being poisoned. I mean, even if you're trying to eat well, it's very difficult. You go around the world and you come back to the United States, and the minute you hit the Miami airport or whatever port you're coming in from, you can tell you're in America because everybody's fat.
Yeah, and it's being exported one
It
fast food chain at a time.
It is, yeah. I started seeing McDonald's pop up in Colombia, and I started crying a little bit.
How about peptides?
I don't understand the war that actually, I take it back. I do completely understand why the FDA has now, made it, put it on the danger list. And it has everything to do with the pharmaceutical companies. And my belief that the FDA is, it's a good organization of people that I think mean well on some level, but they're very compromised with the pharmaceutical company. And so now, these peptides, BPC,
big pharma just wants to get into,
of course,
and get BPC
157 is fantastic. TB 500 is great. I mean, there's hundreds of really good products out there that seemingly don't really have a downside. Even if they're not highly effective for some specific individual, they're not really going to hurt you either. These are amino acids that are in our bodies already.
I'm seeing a trend lately in the direct selling world, network marketing world, of people coming out with natural GLP-1.
Like the precursor or something. That
I don't know. I don't even know what it's made of. Yeah. But they say it gets a GLP-1 effect. Mm-hmm. When you have this, take this pill or whatever. And the same thing is there's others coming out with peptide-like supplements.
What I would say is, I'm fortunate enough to work with a lot of PhDs and real high level scientists. And so, in some of the meetings that I sit in and some of the trainings and conversations about this, I will say that there's an argument to be made about some of these treatments, like specifically NAD. Mm-hmm. NAD is, it's becoming very popular, and we know that NAD is very important for the life cycle of your cells in your body. But in high doses, there's a reason that it takes a 3-4 hour drip in a high dose, because your body has a very hard time accepting it. And it really has more to do with the Krebs cycle, that it's not working. So the precursor to NAD, if you had some kind of supplement that was really the precursor that's helping your body create the NAD on its own instead of just high doses, that is actually probably better, some scientists would say. So I'm not against having alternatives that help get you there naturally.
Know. I mean, like you say, anytime there's something new happens in the world, there's people who come in. It's the wild, wild west for a little while. There's people who come in and make claims and offer promises and charge big money. They're good salespeople. Mm-hmm. I'm trying to understand from a professional's perspective, what's real today, what's suspect today, and what's not real today. Could you answer that?
Yeah. In what sense? I mean, in everything that we're talking about?
Yeah. In this arena of longevity, health span, preventative, what's real, what's suspect, unknown, and what is patently false?
So it's a good question, because, I go to a lot of the biohacker type conferences, and our patients are biohackers, celebrity biohackers.
Sure.
I was at Ben Greenfield's house the other day. We stayed for the weekend for a biohacking event, and there is, this is something that they are all very astute and very, very much interested in trying to sort through themselves. Because, a lot of these guys get into some of the woo-woo side of things, and
sure.
they have these PhDs and medical doctors that are, supposedly more credentialed than them, when they're kind of more bro science type guys. But the truth is that the good ones like Gary and especially Ben Greenfield and the guys that are willing to say,
which are the ones you respect first?
Those two guys. Ben Greenfield's is incredible. Yeah, after spending time with him and a couple of these other guys, he is the most genuine, down to earth, great family guy. And what I was about to say is one of the things I noticed in him very specifically is that he makes sure that he's not selling you just to sell you, just mm-hmm. because he could get a product deal from somebody else or make a couple of bucks. He's really only giving you the things that he has tried, he believes in, he has studied and taken a deep dive on. And then he'll also say, you know what, my opinion might change on this.
Does he have a book?
Several. Yeah.
All right. I'm gonna look him up.
He's great.
How about Gary Brecka?
I love Gary. No, he's great. His wife, Sage, fantastic. They've been patients of ours down in Medellin with us. Gary's a little mad at me right now, but
why is that?
I love Gary. I wish he wasn't mad. You know what? Shit, I haven't said this. Are we allowed to say
It's okay.
that?
Sure.
No, he did me a solid. He did me a solid and introduced me to somebody under, from his perspective, false pretenses. Everything that I was saying to him, I got a little excited and said, "Hey, connect me with this mutual connect. I know him from this guy. We've treated his cousin. We've treated his, other people around him.
Right.
And they've introduced me through text and email, which is true. I was getting introduced from different areas. But Gary was the one that went right to him. And he just said, "Yeah, I got you," and he did it immediately. So God bless Gary. But the way that it was presented, I think what was in Gary's mind and what was reality, Gary went at it in a different way, and I wasn't clear. So now that I reflect on it, I go, I didn't text very thoroughly or thoroughly.
So you
enough.
guys,
I should have picked
are you
up the phone.
guys sideways a little bit?
Right the second, yeah.
Can I help fix
Oh,
that?
fuck, I would love that. Can I?
Cuss
sorry.
all you want.
All right, cool. Yeah, no, I would love that. But look, I could reach out to Gary. I apologize a bunch of times. We'll get back together soon.
Yeah, good.
Yeah, but Grant was just down too, and so I'm sure Grant will.
How about Peter Attia?
Fantastic. Yeah, no, really, really good science and really good information. And I appreciate that he takes a very science forward, efficacious approach.
Huberman.
I love him. Yeah. I don't know him. He inadvertently just mentioned us on Joe Rogan. He was talking about his good friend Danny Way, who we treat, and about how he was down in Colombia getting treated. And so we haven't treated him.
Who else
yet,
is good in the longevity space? I've got Greenfield, Brecka, Attia, Huberman.
You've named the best. I mean, Dave Asprey should be also in there as a notable guy. I'll tell you what I saw. Okay, so you started the question by saying, what's some of the BS? And
what's great, what's unknown, and what's bullshit?
So the bullshit part, I saw some stuff at some of these conferences where there were guys, and the stem cell industry is where I could be considered an expert. And I saw some people out there pitching things in the stem cell space that were just not accurate at all. And one of those specifically was these nutraceuticals that are going to completely replace stem cell therapy, stem cell transplants for autoimmune disease and neurological condition. I mean, listen, we treat spinal cord injury patients, people that are quadriplegics, and they were saying that you could just take this pill and it generates 10 million extra stem cells per day, each pill that you take. And for one, there's no way to test that at all. There's zero way to make that claim. So when I see things like that, I kind of get crazy. That's bullshit.
Okay. Anything else that's nonsense?
There's a lot of stuff out there that is that can't be proven. So I don't know if it is.
So it's unknown. Let's go into the unknown category. What's unproven in your mind that people are out there promoting?
I think that there's some that are proven. Like for instance, on my cell phone, I have this little chip, right?
Yep.
It's supposed to help with the Wi-Fi and concentrate the Wi-Fi. And this particular chip has a lot of studies. And so, I look through the studies and I go, okay, I can see, a real pathway to research. And the more and more you get into the scientific community and you look at research, that can be skewed anyway you
That's
want.
what I was just going to say. Which studies do you trust?
Yeah, that's tough. What I do, luckily I have access to this. I send it to my team of epidemiologists and I say, go through this. And then they go through a specific rating scale and they'll tell you exactly why it's not a good study and exactly why you should trust the study. But not everybody has that access. So it's very difficult. Yeah.
So there's the unstudied world.
Yeah. And some of the stuff, so I was getting into this, there's a lot of other products like this that are just something you set on your desk or something that you wear on your, on your necklace that is supposed to be, sending out a frequency that's going to block all EMF, radiation around you. And doing my epigenetic test at my company, I know that I'm very high in high levels of radiation. But I'm flying in a plane all the time. I'm in the operating room occasionally.
Like there's these devices you can plug in to the wall that cancel all of the whatever radiation types.
Hypothetically, supposedly, allegedly.
Yeah.
But they may.
They use these little wands to be able to find out, look, I plugged it in, look, I unplugged it, and the thing goes off the spike.
Yeah.
And is it a party trick or is it?
I think some of them
just don't know.
Yeah, I think some of you just don't know. That's the thing. They point to the companies that point to other companies' studies are the ones that I'm most worried about because they're not taking the time to invest in their own research and development, meaning they're just kind of trying to sell a product.
Got it. Like the hydrogen water, is that kind of in the unknown category as far as what it really does?
I mean, if you look at the comments when Gary talks about it, and now this is anybody, anybody.
Gary takes heat from
Everybody.
A lot of sources.
Yeah.
But
this is anybody that has a platform, by the way.
Yes, of course. But just in general, some of the scientists I talked to with some of the companies I worked with just said it may, but there's just not enough studies out there yet.
Yeah.
To be able to conclusively say that this reduces the molecule size to the point that it hydrogenates at a different level or those types of things.
Yeah, I don't like people that make the definitive claims. I wish they would start and be a little more emphatic about saying this may, and there's a couple of studies that, that point to it possibly being. So why not do it? It's not going to hurt you.
Doesn't hurt you.
So you might as well.
So I can get behind. Is a big category of it won't hurt you.
Yeah.
But it might not help you.
The truth is I'm in that industry in the sense that, we are still a very experimental industry in the sense that we're still treating rare disease where people are coming to us every day and saying, hey, I have no answers. Surgery isn't going to help. These pharmaceuticals that I've been on for 20 years have failed on every level.
Might as well try.
I might as well try.
I'm not going to take any money with me.
Yeah. So, we're still doing that. Our company is a little different that we won't treat people unless there's been some type of global evidence and research on that specific indication. But our industry is sure throwing spaghetti at the wall and treating these people.
What can you say for sure in your industry?
Orthopedic issues, it's incredible results.
Joints?
Yeah, joints, soft tissue, intra-articular injections. People with that think they're on bone. A lot of times they have a small sliver in there and there's just so much inflammation that it's causing pain that once we reduce that inflammation and start the regenerative process, they actually have a more mobility and limit that, reduce their pain. So orthopedic issues, hands down, amazing. We specialize in spine and disc. So that's something that most other clinics don't do that we're seeing a lot of great results with. And then some autoimmune disease. And then neurological
What is an
conditions.
autoimmune disease?
The most commons that you would recognize would be like rheumatoid arthritis and diabetes. But there's a whole host of autoimmune disease that essentially your immune system is just attacking itself and it could be in various different ways depending on which autoimmune disease. But the mesenchymal stem cells upregulate or downregulate your immune system, as that's kind of the third function that they do very well besides the reducing inflammation.
So they help with that.
Yeah.
And that's like a for sure.
Depends on the autoimmune disease, not all, and there's nothing for sure. It's still medicine. So there's, there's some people that come in.
Well, you have a high degree of confidence.
Very high. Yeah.
What give me a list of the things that you have the highest degree of confidence when it comes to your whole protocol.
We don't treat anything that we don't have a high degree of confidence. So, if you look on our website, there's probably 50 indications that are listed. Those are the ones that we have the highest level degree because we are doing studies.
List some of the big ones.
Some of them I already went through. Spinal cord injury. That's something that we do that a lot of other places can't do because we can go a little bit more invasive.
Right. Joints.
But specific joints. So like any joint, we have
hips,
football players
knees,
that come
shoulders,
in.
elbows, neck.
Teron Armstead came in on when he's in injured reserve for Achilles issue. We have guys, fighters come in with hand issues. Every joint, wrist, elbow, all. Those are amazing. So that would be number one on the list, orthopedic. When you're getting into autoimmune disease, even very severe diseases like MS or even some autism. Now, there's very specific autisms that are more of a gut and neuro issue that are inflammatory in nature. We have very good results with juvenile autism.
So I suppose the way you're saying this is our protocols help with the symptoms of these issues versus curing.
Oh yeah. We never say cure. Yeah, we're not. We would want to at some point, I hope. And we have people that are so far in permanent remission from things like Crohn's and colitis. There's with MS, we don't have anybody that's in remission, but we have seen some major reductions in symptoms. and slowing the progression of the symptoms. And those are the most severe. But there's other things, like chronic pain issues that
do anything with ALS?
No. Unfortunately, it's so
I got
progressive.
A buddy of mine that's grew
it's
up with, and it's just
I wish
tearing him up.
I wish I've seen people go through that, and it's not
No,
fun.
it's not pleasant.
It's horrible. Yeah. And then the last is neurological conditions. So one of the things that really sets us apart is we are doing studies for getting veterans and high impact athletes like UFC fighters and NFL guys back to better brain health. And to hopefully, the thought process and the hypothesis is that we're going to slow the progression of CTE for those that have had multiple concussions. And concussions are just mild traumatic brain injury. So we treat traumatic brain injury patients, neurological conditions like that. So
in my genetic tests, I'm positive for APO3 and APO4.
I'm not familiar.
Familiar with that?
No.
It's like a precursor for Alzheimer's.
Okay.
That just will predispose you to that. It won't say that you're going to get it for sure. But I was talking with a doc this morning. He was saying that hyperbaric will help that a lot. Red light, making sure your vitamin D is topped up. And all the other things that you're doing to keep yourself the visceral fat and to also keep yourself away from being diabetic. They're saying Alzheimer's is really diabetes type 3. Right. That's what they're saying. This is like a type 3 diabetes type of deal. Well, systemic IV stem cell helps lower and it helps create a better environment for the pancreas. It doesn't really help for diabetes type 1 as much. It does if you're in the honeymoon period where you're a child and you're just getting diagnosed with it. We might be able to really help you there. But once you've had diabetes type 1 for many, many years, it doesn't help. But my point is about diabetes type 2, we see some major reductions in the need for synthetic insulin, but it also comes, first you have to do the things that the lifestyle changes that will take you away from maybe needing it at all. If somebody comes down, how often would they need a booster? It depends on the patient. Everything is very personalized. So we have some people that are coming to us in their 20s. They're biohackers. They're already healthy. They're professional athletes. They may not have to come back as much as somebody of my age or your age that has had, a lot of environmental issues. You were overweight at one point. You spent a lot of years not being mobile. So it's all about the patient. But what I'll tell you, and I kind of mentioned before, we treat politicians to point guards to regular guys like me. And what I'll tell you is the Gary Breckas, the Grant Cardones, the billionaires, the kings of country. We have kings that come. They come once a year. Okay. Just for once a year, IV. Do the thing, take a week.
Yep. Wellness vacation.
Annual tune-up.
Yep. And if you look at the cost, you're like, okay, that's $25,000 a year. Well, okay, for a regular guy, maybe you prioritize your health over a new car that year or second vacation.
You're going to pay the hospital. You're going to pay this
eventually.
Ultimately,
yeah.
In my view, one way or the other, you're going to pay one way or the other. What's next? What's coming? What's the next exciting new thing?
Yeah, I'm glad you asked. So, we just really started focusing on exosomes and some other changes in our cell delivery and our cell lines. So we're able to now, because of all of our years of experience and research, we're able to differentiate some of these cells. We're able to take the microenvironment and the culture media and recondition the way that the cells work in your body so we can be a little bit more targeted.
I don't know what any of that meant.
Okay. So for instance, if we have just a regular stem cell in a bag, an IV bag that's going in you, those are all undifferentiated stem cells that are going to go in, they're going to sense your body and they're going to do the magic while they're inside of you. What we're able to start doing is outside of your body, we're able to start saying, Eric has a mid-back problem or he has a neurological condition. Let's focus on that. So instead of going in and changing and doing the slow focus, let's start focused. So we're able to take those cells and make them a little bit more specialized, But I don't think that's the coolest thing that's coming out.
Okay.
The real question is more about the future, I think.
What's the coolest?
And there's things like NK cells, natural killer cells. Natural killer cells may be, and we don't know enough yet, but they may be a piece of the longevity component that helps us clear out our senescent cells. So senescent cells are the cells in our body that are.
I'm guessing they're not positive.
Yeah, no. They're zombie cells. They're just they're still alive. They're still kind of running around, just butting their head against the wall, but they're not helping. They're doing no good, and they're really just taking energy and the mitochondria from your other cells. So we want to clear
these
those
natural killer cells.
Yeah, somebody's affectionately called them zombie cells. So I think that's kind of the biohacker term.
But the NK cells are what would kill those.
Yeah. So the NK therapy would go in and essentially clear out the zombie cells.
NK therapy is natural killer.
Yep.
So natural killers is the future.
I think it's a component.
It could be.
Yeah. And it's not going to be in replacement of stem cell. It's both.
Yeah. And how far off is that, do you think?
Oh, it's happening right now. Yeah, it's happening now. I think that
you guys doing it, or
we're not
thinking
yet
about it?
For sure. We've been researching it for years already.
So how close are you?
We could be closer if we weren't as responsible. We're kind of trying to set the gold standard.
Please be responsible. Stay the gold standard.
Yeah, I mean, we see people that
don't be the first.
Yeah, we see people that are using it now in other places, and we're just there's not enough.
What else is coming?
What else is coming? Yeah, one of the reasons that I called my company BioXcellerator instead of the Panama Stem Cell Institute or whatever is, which most people in the space are doing, is because there's always going to be something coming. Yeah. And so this is why we invest heavily in research and development, which a lot of other places don't. They're just injecting you and sending you on your way. We spend millions every year on research and development. So I don't know where we're going to end up,
but nothing outside of NK cells. There's nothing that comes to mind.
There's tons of stuff. The CRISPR technology.
I can't wait for the CRISPR. Please.
Yeah, if we could start incorporating that into preventative.
For those that don't know the CRISPR, there's the science is there to be able to change your genetic makeup, but currently to do that it would kill you. So the CRISPR will the technology. Jennifer Doudna's probably the one who kind of pioneered that. Yeah.
Yeah, I've heard. There's others, but she's more notable.
But the CRISPR is a technology that would change your genetic makeup and the setup inside of your body without killing you. So if you're genetically predisposed for something bad and it was headed your way, you could go in there and turn a 1 to a 0 or a 0 to a 1 in your genetic code and change that predisposition. Is that accurate?
Yeah, that's. I mean, I'm sure that's scientists would go deeper, but yeah, for sure.
The general amateur theory is that when it comes to CRISPR.
Yep.
Correct?
To my knowledge, yeah, that's
okay. And that's something that I've heard is getting close, but it's something being developed here in the United States for sure.
Yeah, the problem is that the United States has some of the best research on the planet. We have the innovation, not just in business, but also in science. But then we're forced through regulation and government entities like the FDA, we're forced to push it offshore. Mm. So now you're seeing CRISPR in Japan. You're seeing it in some of these other medical tourism destination type countries.
They're starting to do it?
They're starting to do it a little bit, yeah.
Wow.
Yeah.
So that's a little too early for me.
Yeah.
It's like Neuralink. It's just like, I don't want to be the first guy.
Yeah. I'm very excited for that because we treat a lot of spinal cord injury patients.
Yeah, no, for sure.
And they need it. And I think that in combination with what we're doing. And
do you think you'd work with them at some point?
Oh, absolutely. We're already dedicating a lot of our efforts to spinal cord injury. So we have,
go in and help to rewire.
Yeah. Wow. If it creates some synapses or it is the jumping point to having the communication, these guys, the guys that we see are in the right mindset to really beat that injury because they're working hard every day. It's not just stem cell therapy. It's also the physical therapy.
Yeah, I just watched an 8-hour podcast with Lex Friedman and Elon Musk and the whole Neuralink team and the first person who has the Neuralink installed in their brain.
I'm not all the way through that because it was 8 hours.
It's above my pay grade for sure to try and understand. But we're living in an interesting time, where possibilities that think about 100 years ago, everybody's just trying to figure out how they're going to eat.
Yes. I remember watching Star Trek as a kid, the one on TV before the movies.
Right.
And, you see that little thing, they flip up and talk to the other person and they see him on the phone and then they wave it over you and they can tell what's, some of your vitals.
Yeah.
And I thought, oh, that's never going to happen. Well, we have it out now. It's a cell phone.
Yeah, exactly.
Yeah.
So, well, this is all fascinating, and I appreciate you kind of sharing and helping to educate me. I think it's very high likelihood that at least from this conversation, you've got a client or two between my wife and myself. But give a piece of advice for somebody who can't afford this right now. And then give a piece of advice for somebody who can afford this right now. And again, the name of the company is BioXcellerator. The website is bioaccelerator.com.
Yep, correct.
BioXcellerator with an ACC.
BioXcellerator.
Hold on. I will put this in the show notes. BioX
and then CELL. Cells. CELLATOR.
ATOR. BioXcellerator. Accelerator?
Oh, no. Did I not have the E in there? BioXcellerator. BioXcellerator.
E-T.
Did I just spell my own company wrong?
I don't know. We'll have it in the notes.
BioXcellerator.
ETAOR.
BioXcellerator.
ETAOR.
You definitely have to cut that part out if I just spelled that wrong.
No, it's fine. It's fine. We'll put it in the show notes. Everything's fine. So give a piece of advice for somebody who can't afford this right now, but wants to live longer and healthier. And then a piece of advice for somebody who can.
So my advice for somebody that can't afford it is going to be similar to the person that can afford it, in the sense that one of the key components to all success, all great relationships, and you could probably put this into many facets of life, but it's your mindset. And so first you have to get in the mindset of what you're looking to achieve. And if that is health, if you want to live longer or feel better in your advanced years, you have to start putting your focus and your mindset in on exactly that. And so no matter if you can afford it or not, you have to be in the mindset. So very much like Gary says, you don't have to have a $120,000 Theralite red bed. You can go outside and get some early morning sunlight. Yeah, it's not easy to wake up at 4 a.m. or 4:30, but that's what you have to do if you don't have any money. You don't have to have the PMF bed that's $50,000 or the mat that's $5,000. You can go downstairs or outside your house and ground yourself. And that all starts with mindset. So, there are things like stem cell therapy that are very expensive. You can't access that for free. Unfortunately, fortunately it is the most advanced, therapies on the planet. And we're living in this time, as you mentioned, that we have access to these things, but those type of things are not cheap. So you also have to be in the mindset to understand how to achieve it. Do you not take, well, for one, you prioritize your health. How much is your health worth? Do you not take a vacation this year? Do you not buy a new car? Do you make some sacrifices to get that therapy, knowing that it's going to help you live longer? Then I would argue that, yeah.
Is it something that you feel like you need to do every year, or can you do it once and get a lot of great results for a long time?
Yeah, we have a lot of autoimmune disease patients that had, they were in chronic pain for years. They got one stem cell therapy and they've never had to have another one. Now it's still young. They may progress in their ailments and their age, and they may have to come back in 5 or 10 years. But Eric, when I set up this company, I purposely set out to have a bad business model. in the sense that I want to treat people once and never see them again. I want to help people and have it be a one and done. But for people that are in the longevity and health optimization space, and especially our professional athletes that are continuously using their bodies, depending on their bodies for their livelihood and hurting themselves, they're going to have to come back several times, once a year or once every other year.
Yeah. Their body is their business.
It's and their family's livelihood and their fans and their organization and their teammates.
We only get to live once. Might as well do the best we can, right?
Yep, absolutely.
Do you have a book?
I don't.
Well, you got to fix that, bro.
Yeah, for sure.
You got to get in the conversation with these other geniuses.
I grew up this dyslexic kid that just really
I was terrible with books too.
Yeah,
I was convinced not to write a book by a billionaire who created courses. He said, "Why would you take everything you know, put it in a book, sell it for $12?" And it was the dumbest advice I've ever received in my life.
Really?
Because I sold 5 million copies, self-published of my book.
That's huge.
And it changed the game.
Yeah.
I became that guy.
That's amazing.
So come up with a cool title, BioXcellerators or whatever you want to call it, and get that out there so the world can see it.
Good advice.
It'll be a good marketing tool for you.
Cool.
So I appreciate you coming by. I appreciate you sharing this. You'll be hearing more from me as far as next steps. I'm going to connect you with Gary and others.
I'll eat crow with Gary myself as well.
Yeah, no. Yeah. So he and I are supposed to talk today. So anyway, thank you for all of this. Thank you for the kind of the honesty as far as the process. And I look forward to seeing you in Medellin.
I really appreciate the opportunity. It was a good conversation. Thank you.
You're welcome. So that's my conversation with Eric Stoffers. I hope you got value from it. I know that I did. I'm so fascinated with the concept of longevity. If you know somebody who's interested in this idea, the whole stem cell conversation, the medical tourism conversation, maybe forward this to them, see if they might get some value out of it as well. All of the links, all of the if you need more information, we'll put all that in the show notes so you can have access to it whenever you'd like. So hope you got value from it. And until next time, have an amazing day. See you soon.